Good afternoon, everyone who is joining this
Good afternoon, sir.
panel discussion from South and Southeast Asia. And hello to other who have actually joined from elsewhere. On the behalf of WHO FCTC Knowledge Hub on Smokeless Tobacco and FCTC Secretariat in Geneva, I would like to welcome you all and honor to each one of you to this important online panel discussion on 20 years of WHO FCTC, advancing smokeless tobacco control and protecting youth from industry interference. I am Dr. Prashant Kumar Singh. I work as a scientist E as well as the nodal officer of the WHO FCTC Knowledge Hub on Smokeless Tobacco. And in this webinar, we would be actually touch upon a very important aspect of the tobacco control, which are very important from the perspective of South and Southeast Asia. So I would take a very brief overview how this theme is very important. As we know that it has been almost 20 years of the FCTC, and a great achievement has been received in terms of declining the smoking prevalence in large part of the world, including South and Southeast Asia. However, when it actually comes to the smokeless tobacco, the decline is not that much evident, which we actually expected. The region itself holds approximately 80% of the smokeless tobacco users. And now, in past few years, with the witnessing of a very worrying surge in the availability and marketing of the emerging nicotine products, often promoted as a safer alternatives, the entire region is at the crossroad of dealing with two very different but very important form of the tobacco. So this year's the World No Tobacco theme actually talks about unmasking the appeal and exploring the industry practices on tobacco and nicotine products. This panel discussion has been organized with the main aim of reflecting the achievements of past 20 years in terms of smokeless tobacco, examining how the industry is targeting youth through smokeless tobacco and other emerging nicotine products, and what are the key regulatory and policy gaps which are being evident in this part of the world. And I don't have much to say about the richness and the depthness of this panel which we have today from various part of the region who have largely extend their life and their their professional achievements in the tobacco control across this part of the world. And to start the panel discussion, I would urge now to our director, Dr. Shanli Singh, to actually deliver her brief note on how the tobacco industry is actually playing with the young population in this part of the world. And I would like to tell you about a brief bio of Dr. Shanli Singh, who is the director of ICMR, National Institute of Cancer Prevention and Research in Noida, as well as the director of WHO FCTC Knowledge Hub on Smokeless Tobacco. She is a clinician with almost 38 years of experience. She has a significantly advanced contributions in early detection strategies for oral breast and and cervical cancer in India and other low and middle income countries. And she has led various initiatives to regulate the smokeless tobacco products within the country. Under her very able leadership, NICPR is strengthened the cancer prevention through capacity building and research-driven intervention. She has extensively published in various national and international journals, and her focus remains on advancing the cancer prevention and tobacco control in this region. So, ma'am, I can see you are available. I would now actually request you to video take over.
Yes, thank you. Can you hear me?
Ma'am, your
Can you hear
voice...
me?
Yeah, ma'am. Now it's
Am
clear.
I audible?
Ma'am, not that much clear. So I would actually request you if you could just switch off your camera and then probably speak. Yeah, ma'am, please go ahead.
Am I audible now?
Yeah, ma'am, much clearer.
Audible?
Yeah, ma'am.
Okay.
Much clearer.
Yes. So thank you, Dr. Prashant, and thank you everyone for this patience. Technology, and I'm just traveling back and from the airport back to the institute. So sorry for this delay in joining and maybe a little bit of voice problem also. But I would like to congratulate each one of you for joining this very important panel discussion. And as you know that at the National Institute of Cancer Prevention and Research, we host the WHO FCTC Knowledge Hub on smokeless tobacco. And this year we are actually marking the 20 years of the WHO FCTC. And the theme of this year is to protect the youth and the children from the tobacco industry interference and to expose the tobacco industry interference in, they're trying to create all sorts of myths and misconceptions and say that, these are harmless products and we are trying to reduce the harm. So there's so many myths about that. So actually it is not one person's or one organization's job to control the tobacco industry. And so 20 years ago, the first global public health treaty came into existence as the WHO Framework Convention on Tobacco Control, as it is called. And today there are 183 countries who are party to this convention. And they're all trying to help each other to control the tobacco industry's strategies and to promote their policies so that they can control tobacco. And a lot of countries have actually put out their documents to end the tobacco game and so on and so forth. And our country is also trying its bit. And so in our country, the problem of tobacco is not necessarily the smoking cigarettes. It is smoking of bidis and smokeless tobacco. So smokeless tobacco actually is the biggest problem in our country and also the Southeast Asia region. And as many of you would know, and of course realize that there are more than 355 million smokeless tobacco users globally. And of these, 200 million themselves are in our country. Now, so we have a great responsibility for promoting all the policies so that we can control the smokeless tobacco use in our Southeast Asia region. And the hub leads its various activities in terms of generation of new knowledge on the use of SLT products, the smokeless tobacco products, what are its practices amongst the users, as well as what are the industry tactics which they are using to promote these products. And so from that point of view, today's webinar and the panel discussion, which Dr. Amit Yadav is going to moderate, is on protecting the youth from the tobacco industry interference for the smokeless tobacco products and emerging nicotine products is very important discussion. As most of us realize that the tobacco industry would not have survived had it not made and presented smokeless tobacco products as such a very useful and such attractive packaging, and its advertisements, which are actually misleading advertisements. So because tobacco kills half of its users. And we also know that if by age 2025, people do not initiate tobacco use, then there are very unlikely that they will use tobacco in their later lives. So it is through children and through the youth that the industry is trying to keep the number of users at that level or maybe even increase them. So we have to actually find out what are these tactics that the industry is using and how we can counter them, even though we actually should not be caught on the back foot that against. So we should be thinking much ahead of the industry, which is very difficult, but nevertheless, we are all trying. And so there are various topics that which need to be covered in today's panel discussion, and especially what is that which keeps people, continue to use these smokeless tobacco products even despite knowing that they are harmful. And what are the other SEER region countries? What tactics or what policies are they adopting, to either stop the use, develop policies for banning and marketing these products? So all these very interesting discussions we have with us, several leaders in tobacco control, both from the SEER regions as well as from our own country. And I'd like Dr. Prashant to ask Dr. Amit Yadav to introduce them one by one, and also take this discussion forward while we are all listening and making notes, and hoping that this panel discussion will be very interactive and it will give us some new knowledge as to what are the way forward, how we can control and prevent our youth from getting attracted and using these smokeless tobacco products and the new emerging nicotine products. So thank you from my side for now, and I'll be listening very carefully. Over to you, Dr. Prashant.
Thank you so much, ma'am. And to move on with our panel discussion, I have two things to mention over here. One is about that a slight change in our plan. Instead of having the closing remarks, what we have done is that we have actually created 7 questions for all our online participants. And after our panel discussion, those all 7 questions will appear on your screen. And I would urge and request each and every participant over here to actually provide their responses, because that would actually help us to gauge the entire sense of the issues which we are actually covering in this entire panel discussion. So now we would actually transition into our next most important part of this panel discussion. And what I could actually see is that the kind of panelists we have for this discussion, it is approximately 120 years of experience they are actually bringing together. So it's a great day, at least for me, to actually get these panelists on board. And to moderate this session, we have a very eminent Dr. Amit, who has almost 20 years of experiences in the tobacco control. So Dr. Amit Yadav has 18 years of experience in the tobacco control with advanced training from Johns Hopkins, Melbourne McCabe Center, World Health Federation, and US National Cancer Institute. He has worked with prestigious organizations, including PHFI, ICMR, NICPR, and University of California. As a elected board member of the Framework Convention Alliance, he has attended WHO FCTC meetings and provided technical support globally. With over 70 publications and his own very book, which entitles The Public Health, Tobacco and Trade in India. He currently serves as the Deputy Director, Tobacco Control at the Vital Strategies, and he is also serving as a Senior Fellow at the Center for Public Health Research, Kolkata, and an Honorary Professor at the National Law University of Tripura. So, Dr. Yadav, thank you so much for joining us, and the floor is now yours to take this entire discussion forward.
Thank you, Dr. Prashant, for that introduction, and I'm really humbled. And thank you for this opportunity to moderate this session. As we look at the 20 years of the WHO FCTC, this is one of the most celebrated international treaty, one of the most profoundly adopted and well adopted and widely adopted by the UN members, 183 members of a treaty. This is not a small fiat for any global treaty. And with strong public health background and the provisions which are within the treaty, all the countries set to implement. Our region, which is Southeast Asia region, we played a very strong role, and especially the countries in this region, they played a very productive and progressive role in strengthening the FCTC since its inception, since its negotiations and then adoption, and also subsequently during the COP process, and I think the conference of parties of the treaty. So it's very, very important, and that we are having this webinar to mark the 20th year of the FCTC, and also this year's WNTD theme, which is unmasking we all know tobacco is a marketed disease product, which generally thrives on young people, young adults, and minors and young adults, because it creates that glamour and it creates that the strategic, tactical presence, whereby enticing young people to use this product, because the 50% of its user they are losing because of the death and disease caused by tobacco use. I am privileged to have a celebrated panelist on for this discussion. Our focus will be looking at the smokeless tobacco control bit under the FCTC, and also the national level best practices and what we have learned in last 2 decades, and what are the way forward for us as we move in the third decade of the FCTC, and how do we also looking at the current WNTD theme, World No Tobacco Day theme of unmasked appeal of a smokeless tobacco, and also discussing what strategies the smokeless industry is adopting in doing this. So I have the privilege to introduce the panelists. So I have Dr. L. Swasticharan, who is currently the Deputy Director General and Director of Emergency Medical Relief at the DGHS, Ministry of Health and Family Welfare, Government of India. Dr. Swasticharan is a senior public health official of the Government of India, and he has been serving in the ministry for now, I think more than a decade, looking at the tobacco control program. He is an MBBS from the Manipur University, MD Community Health Administration from Delhi University, and Master of Public Health from SC University, New Zealand. He has also, other program that keeps him always on his toes is the emergency medical services, and from global to national health emergency. He is the one person who looks at them as well for our country. He has been looking at three major programs which pertains to NCD, and they are National Tobacco Control Program and National Oral Health Program, and also the program for prevention and control of NCDs in the country. He has an extensive experience in health system and health administration, and training and capacity building of health professionals across in NCD prevention and control. So I invite you, sir. And he is also have great experience in the COP process. He has been part of the FCTC for long. He has been leading India and the region in the COP and MOP discussions. So we'll hear from him. Welcome, sir. I have Dr. Jagdish Kaur. Dr. Jagdish Kaur is the Regional Advisor, Tobacco Free Initiative at the WHO Regional Office in Southeast Asia in New Delhi. She is a distinguished public health professional serving as Regional Advisor. She oversees comprehensive regional strategies for the region to combat smoking and smokeless tobacco menace across the region. She has been instrumental in advancing regulatory framework to restrict the surrogate advertising, looking at, and she also has a very keen interest on the research aspects of tobacco control in the region, specifically in the region. I really admire her work to actually figure out the morbidity due to the secondhand smoke exposure and actual morbidity. We were quoting the data for 13.5 lakh deaths, but I think the new data from Dr. Kaur and colleagues suggests that it is almost a double. So I know it's a comprehensive work, and she has been leading in the region. Welcome, ma'am. We look forward to have this interaction with you. I also have Mr. Ashish Pandey, Director Tobacco Control, Southeast Asia and Eastern Mediterranean from Vital Strategies. Mr. Ashish is looking at the region, both the region for over 20 years, with over 20 years of experience in tobacco control and public health issues, working with the governments and civil society organizations in the region, including Bangladesh, Pakistan, Sri Lanka, Maldives, Jordan, and other countries in these two regions. Formerly, he has also worked with the Union, the International Union Against Tuberculosis and Lung Disease, and also worked at the Ministry of Health, Government of India. He holds a Master's in Public Administration and a Diploma in Rural Development, and is a scholar of Johns Hopkins Institute, and has notably led the work, and especially I think this is in the Bangladesh, currently the Tobacco Free Railways Initiative. I think Mr. Ashish Pandey has contributed with the Bangladesh team to get this through in the country. We have from Bangladesh, Professor Rumana Haq. She is professor at Department of Economics, University of Dhaka, Bangladesh. Thank you, ma'am, for joining us for this panel discussion. Dr. Haq has over 2 decades of experience in health system, healthcare financing, and tobacco control. She is also executive director of the ARC Foundation, driving policy-focused public health research. Dr. Haq also has saved Bangladesh tobacco control efforts, particularly in taxation, secondhand smoke, smokeless tobacco regulation, through close collaboration with National Tobacco Control Cell. Dr. Haq holds a PhD and MA in health economics from University of Leeds, and has received global recognition from Johns Hopkins and IMF for her work. Her evidence-based advocacy continues to influence health reforms in Bangladesh and broader Southeast Asia region. Welcome, ma'am. Last but not the least, I have Dr. Manuja Pereira, Senior Lecturer, Department of Public Health, University of Kelania, Sri Lanka. Dr. Manuja is a board-certified specialist in community medicine, affiliated to Department of Public Health in the university as a senior lecturer. She has experience working in the field of national level public health institution, and prior to her career as an academic, with a background in the field of medicine and community medicine, her specialty training on investigative research from University of Bath, UK. She is the founder, editor, and project director of Center for Combating Tobacco and the Tobacco Observatory in Sri Lanka. Southeast Asia region established under WHO FCTC 5.3 and a strong advocate on substance use control. She also serves on the board of directors of Alcohol and Drug Information Center, a strong organization in Sri Lanka, EDIC. In addition, she is the founder, patron, and a director of the Young Professionals Alliance for Health, a social enterprise development Sri Lanka. So we have, in terms of, as Dr. Prashant said, over 100 years of experience put together here in the panel. And we look forward to have this interaction across the four important areas that we are looking at, 4 and 5 important areas, that how tobacco industry is evolving and evolving in terms of targeting the youth and their tactics, the regulatory and policy gaps in SLT control, role of youth engagement and education, country success stories from the different countries which are represented on the panel, and impact of digital marketing on the youth tobacco initiation. I think technology, one of the flip side of the technology has been that it has been now used by the sin industries, alcohol, tobacco, and fast food, to actually lure young people, young minds, and get them hooked to these products. So how to handle these tactics. So I will straight away get into the questions, and I would invite initial remarks from all the panelists, maybe for a couple of minutes on smokeless tobacco use, but especially looking at the country perspective and overall regional perspective. So I'll request first Dr. Swasti Charan, if he could throw some light on India's some of the regulatory success and gaps in controlling smokeless tobacco, especially related to youth. So Dr. Swasti Charan, over to you.
Thank you, Amit. First of all, thank you for inviting me here in this very important topic, and very rightfully, but very sadly, India is housing the knowledge hub for smokeless tobacco globally, because we have the maximum number of smokeless tobacco users in the whole world. That's the first thing. And then the Global Adult Tobacco Survey, the second round, also tells us that we have about out of the total 26.7 crore, which amounts to about 28.6% of the adults using any form of tobacco, we have 18% of them, which amounts to about 19.9 crore people using smokeless tobacco in this country. That roughly stands out to be 1 in every 5 adult individual in this country. And we also have some dual users. And what's also alarming is the age of initiation in the GATS survey is is about 18.8 years. So that is also indicating how the young people are initiating the smokeless tobacco users as well. And the other alarming thing which we also have is just like the loose cigarettes, we also have certain alarming practice of purchase of loose smokeless tobacco products, which is currently to about 50% of that. And 96% adults, fortunately, know that smokeless tobacco causes serious illness, and 50% of these smokeless users were planning to quit tobacco. So these are some of the good news, some of the bad news, and overall, we are supposed to regulate this product in this country. But India tries to use all existing laws, not just the only dedicated law of the cigarette and other tobacco products act in this country. So the many of the Indian states, the health is a state subject in this country. So many of the Indian states, almost all the states and the UTs have banned at some point of time Gudkha, which is a mixture of tobacco and arecanut, which is very, very alarming, because since it's a mixture with flavors, with tobacco and arecanut, many children pick this up. But the Food Act, which is on a Food Safety Standards Regulations 2011, prohibits tobacco and nicotine as food ingredients. Under that, many states have banned ban Gutkha, one of the smokeless tobacco product, which we think is a good thing for us. And our national tobacco testing laboratories have played a very crucial role in this. And we have the last pictorial health warnings in all the tobacco products also, being followed for the SLT product, which covers about 85%, and also the online reporting portal which allows the civil society or the general public to report the violations under the CODPA and the new Electronic Cigarettes Banning Act, known as the PECA. Now, we also work very closely with the schools with what is known as tobacco-free educational institutes. We have a separate guideline for that, which tries to implement as per a scorecard many of the sections of the Cigarette and Other Tobacco Products Act, which is applicable to the educational institutes. We have vendor licensing in some states, which allows us more regulatory mileage there. But what are the gaps which is alarming for us is the unregulated and the unbranded SLT products. Now, when it is available in the market, then it is like an illicit tobacco which is coming there. They are affordable, they are accessible, and they are equally harmful. That's one of them. The vendor licensing, which should have been there, which we wish to have it nationwide, is still inconsistent. It's not there. Many of us, we all know that Vital Strategies has been working in this area along with the state government as well as the municipal corporations, but it's not yet uniform. It's not yet consistent all over. The online and the informal sales is one which is alarming for us, because the e-commerce platforms or the local delivery system bypass the age restrictions and the advertisement bans, etc., which is there for purchasing tobacco in this country by minors. And also the peg warning, which we say it's 85%, but if you see many of the SLT products, many of them would have manipulated, and when it is done in the large stage, the regulations, the enforcements become a challenge. Despite all this, we are hoping that we should be able to curb the menace of the smokeless tobacco in this part of the world, and also pass on that good practice to the remaining parts of the world, so that we at least take care of one major component of tobacco products. With this, thank you once again for inviting.
Thank you, sir. Thank you for your comments. And I think I think especially in terms of banning Gutka, it has been a leading work that India has done, and a lot of things. And I see your sentiment in terms of happiness and sadness, at the same time, that we have the global hub, but we are also the hub of the highest SLT use in the world, and we need to lead that the counter mechanism for SLT control as well. That's the idea. I'll go to now Dr. Kaur. So for your comments, ma'am. And if you could highlight what are the regional patterns of SLT use among youth, focusing on youth, and how the countries in the region, they could actually counter some of these industry tactics, and especially in the time of the digital marketing surge. So what could be the regional strategy in that sense, and the patterns? Over to you, ma'am.
Thank you so much, Ahmed. So moving from India to the Southeast Asia region, we as Southeast Asia region, cater to 26% of the global population and have 77% of the global smokeless tobacco burden. So the highest burden of overall tobacco use as well as the smokeless tobacco use. So that's a big thing, that's a big challenge we have for and that contributes to the global tobacco control, because unless and until we work here for smokeless tobacco control, I don't think there can be a dent in overall tobacco control. I always say that. And out of that, the major burden comes from India, like we heard from Dr. Swasti. And we are celebrating 2 decades of the treaty, FCTC. now this year. So that's a landmark thing. We have come a long way, in the global tobacco control. There has been decline in the tobacco epidemic. The curve is bending. But there have been more challenges, like nicotine products, new and emerging products. So the epidemiology of, the tobacco epidemic, it's now changing. So industry has given us more and new challenges, which we need to deal with. And in fact, treaty is also, kind of challenged with the new developments which the world is facing and most of the countries, as part of that. For us, as per the Global Youth Tobacco Survey, which caters to 13 to 15 years of the school-going children, the tobacco use is 3.6%, 4.4% for the boys, and 2.8% for the girls. So it's overall 4 million children, 3 million boys, and 1 million girls. Among the countries, Nepal has the highest tobacco use prevalence among the youth, followed by Timor-Leste and Bhutan, and then Maldives, Myanmar, Sri Lanka, India, and Bangladesh. But I feel, these are quite underestimated figures. One is that it only caters to 13 to 15 years old. And smokeless tobacco, as per se, children start using very early. So I have been advocating for, when we have this survey, we should include, I think 10 years onwards. Then only you will get the correct picture, how many children are getting, because only 13 to 15 years is not going to get you the correct figures. And most of the countries, they don't collect data on areca nut products, because smokeless tobacco and areca nut use, they go hand in hand. So unless Maldives, collected this data, and in fact, they included a wrong question and we got that combined data, and that was almost 46.6% of their children, 13 to 15 years, using these products, areca nut as well as smokeless tobacco. So that is mind boggling, because smokeless tobacco products flavored, because now the flavor thing, it's come to smokeless tobacco, nicotine products, and that is the main issue which we are, facing, because that leads to attractiveness. And this is what we are talking and masking the appeal, how these products are so appealing now this year. And we keep talking about during most of the World Health Days, tobacco industry and masking the appeal, other things, how to counter this. So we need to look at these things. We need to capture that data, because, all your policies are driven from quality data. If you have the quality data, then only you will be able to address to that issue. If you don't have that data, then you can't properly address that, because the last round of GYTS in India, that faced many issues. So I think those will get addressed in the new round, which now they are having the 5th round. For the what they are doing policies to counter the tobacco industry, because all the countries, they have the these FCTC, they are parties to the FCTC, they have tobacco control laws, most of them have tobacco control policies and the national tobacco control programs. So they deal with this overall. And the countries which have high prevalence, they have different policies in place. For example, we heard from Dr. Swasti Charan, they ban tobacco. That is the extreme end of regulation where the ban is there. But then we know the implementation challenges, and the other things which are there, how it is difficult, at the ground level to deal with these challenges. Nepal, they do, they have ban on smokeless tobacco use in public places. So those kinds of policies are there. And Sri Lanka is now facing a lot of surge in smokeless tobacco use, especially among the youth. Maldives is facing that. So there, Bhutan has that issue. Timor-Leste, in fact, there in Timor-Leste, 15% of girls and 12% of boys, they are using, smokeless tobacco. So that's a huge figure. And that is the country where, among women also, the highest smokeless tobacco use prevalence is there in the region. So while we deal with smoking and other things, then these things also keep coming up, and then we need very targeted, focused policies for that. For the digital marketing, because that's a thing which everybody is facing. So there is a lot of advertisement through the digital platforms, through the social media, through the OTT. We know India has a law, but then so many challenges are there. And then marketing is there because internet sales. So youth have access, to the internet, and they get their products, and there is a lot of marketing happening in different forms, because not only the traditional medias, the mass medias, electronics and otherwise, but industry is using now this digital media. So that is difficult to control, I think, because a lot of inter-country, inter-regional collaboration is needed with that, because otherwise it just goes beyond your existing policies. So countries are concerned about that. They are doing their bit, and they are trying, different things, and having even school level programs to tell the children, like what all is going on. So all these things are there, but I think there is much, much more to do, because like Dr. Shalini said, that, keeping the pace with the industry, because that's a very, very difficult thing, because they're all always ahead of us, many steps ahead of us, because they put a lot of resources. They are so resourceful. They put a lot of money into this advertising and promoting their things, and always come up with the new things. Like I said, that the entire tobacco epidemic is converting into the nicotine epidemic, and they come up with the new products. So we take time, to study all this, and they'll come up with the new things. So that is the, where we lack the pace and other things. But I think with more collaboration, everybody being together, and that is what FCTC is for, bringing everybody, because the cross national present this existence of the industry, but then I think fighting with them together, that is what is needed. And now, uh, you know, looking at what has changed, what is coming up, learning from, other countries where this problem is, what they are doing, from best practices, sharing our best practices, our experiences with those, so that everybody they don't have to reinvent the entire wheel. Then I think we can do much. We can do, what all is needed, and where it is needed. So this is what I think. So the countries have to hold hand with each other, and we facilitate that from the regional office, and everybody has to work together for tobacco control. Thank you so much.
Thank you, ma'am. Thank you. I think that is a good message, and we see that how in the digital space, and how youth have now increased access to the digital tools, and until and unless in terms of we work together. I think one of the thing within the treaty document also talks about cross-border advertising and promotion of tobacco products, and I think it is important that we collectively address that issue. Thank you for your comments. I would now go to Mr. Ashish Pandey. He is working in Southeast Asia and the EMRO region as well. And works closely with the government and civil society together in this region. So I would want to hear from Ashish, what kind of experience you see in the region, maybe both the regions, and there are similarities in the two, in terms of from the government side, in terms of the regulatory framework, and also the civil society interventions, and then how they have been impactful, or they know what is the role that they have played in advancing SLT control in the region. What is your experience, and any good practice that you would want to share?
Thanks, Amit. And first of all, let me thank you for inviting me. I'm honored to join this esteemed panel with few of my mentors in this panel, with whom I really learned about public health and integrities of tobacco control. I'm overwhelmed. Let me put it in this way. First thing. As we reflect on 2 decades of WHO FCTC, which is, I think, a lot has been talked about, we need to understand the very first thing is globally, what is the landscape of tobacco use, and why smokeless tobacco didn't get much attention so far. As we see globally, the number of tobacco users globally is like currently 1.5 billion, and out of that, over 1 billion are smokers. So this smokeless tobacco problem is very concentrated in our region. So that has been possibly the one thing why it has been treated. The second thing, what I feel, and since when I started working in smokeless tobacco, most of the time I hear about smokers and smoking form of tobacco use. Somehow I feel that the smokeless tobacco is treated as an invisible cousin of smoking tobacco. And that has created kind of a two-tier system in tobacco control, where most of the people have concentrated their effort in controlling a smoking form, and there are very limited people who have been giving attention to the smokeless form. Thankfully, in the country like India and a few others, they recognized this problem and started taking this initiative. I understand when you see the global trend, the drop in smoking is much steep than the smokeless tobacco. However, the work on smokeless tobacco is also progressing. The challenge what Jagdish ma'am has also highlighted is the industry is aggressive. So they have realized this, that the smoking form of tobacco is going to die sooner or later. And that's where they have started thinking and switching their trade practices and tactics, and started using all their resources to put forward and promote smokeless tobacco or other form of tobacco. One is we are still talking about a smokeless form of tobacco. There's another form which is coming is a non-tobacco. It's only just nicotine. So that is also somewhere in their sleeves, which is they are taking out in the region. When you talk about the regulation, what works, as Dr. Swasti has also mentioned, the ban of mixing tobacco in food has really make a big awareness in the country. And I think that is something which has really contributed in those 4% of reduction in smokeless tobacco in between GATS 1 and GATS 2. Of course, there is implementation challenges. They came out with the twin package, and those are the other things that we can discuss later. Similarly, a few countries like Bangladesh, and at the beginning, somebody talked about Railway Department's initiative. So let me share about the example from there. They have started treating both smokeless and smoking form as one. And they are talking about a tobacco-free railways, not smoke-free railways, not just that part. And that's where they have banned all form. Like they banned smoking, they banned taps, they banned even the sale of tobacco in all their premises. They have gone a step forward where they have declined transporting tobacco products. That's, I think, only in the world any government or any government-owned railway have taken that bold initiative. They said that we will not even transport tobacco products. So that kind of effort definitely put smokeless tobacco at par with the other regulatory initiative. That's one. Second is graphical health warning. When you put the similar level of a graphical health warning as a smoking form, it denormalizes the use of smokeless tobacco. I grown in a central part of the world, and I've seen that there is some form of a taboo in smoking, but smokeless form is totally accepted. It's deeply rooted in the system. Nobody's talking about, nobody's questioning about that. So that's the second thing, and that's where I see many countries have, as I talk about different tier of tobacco control. Like in Pakistan, they have pictorial warning on smoking form, but not on smokeless form. Why? We need to think about that. The second part that you talked about, what is the role of civil society in community-based action? I think civil society we have been using this word more often as a watchdog, catalyst, and facilitator in tobacco control. I think grassroots organization has driven public interest litigation. They have trained officials, monitor tobacco industry activities, ensure policy doesn't just stay on paper. In again, another example I can give from Bangladesh, where the civil society has done this large-scale market survey to list out how many the smokeless tobacco product brands are there. Even the government doesn't have that data, and then share with the government that this is something that we are missing. Because in taxation, in Bangladesh, and Rumana Appa is there, she can talk more about that. In taxation, Bangladesh, smoking has a much higher tax than the smokeless form. And government, because they know that there is a limitation in tax administration and it's largely unorganized sector, they don't even want to raise it. That they said that what is the point if we cannot collect it? So that's where the role of civil society also come to highlight that. The community surveillance, that's the power of community surveillance. And also training youth volunteer and local leader to monitor and report will definitely foster the accountability from bottom up. So I think I'll stop here, and maybe we can talk more about that.
Yeah, thank you so much, Ashish. I think good examples from Bangladesh and other part of the world. I think civil society plays a very significant role when it comes to advancing tobacco control. The WHO FCTC realizes that and mentions engaging with the civil society. I think our National Tobacco Control Program in India also mentions engaging with the civil society to advance tobacco control. And I think further, especially when we are talking about young people, I think apart from the school setting, every other settings you would find that the civil society is engaged. And even in schools, I think civil society had much better access and looks like a neutral one, and not as a regulator to be there and talk about awareness, capacity building, training, and I think all those areas. And you have rightly put that it plays a very important role. As you were talking about taxation, so we'll go next to Professor Rumana Haq, and inviting her comments on the smokeless tobacco products and how I think what is the role of the fiscal policies and taxation, and how that helps in controlling smokeless tobacco, the experience from Bangladesh, and are there any other countries in terms of SLT taxation or other fiscal policies that we can look up to? Dr. Rumana.
Thank you. I again would like to thank you for inviting me in this very important discussion today. And I really feel honored to be in the panel with all esteemed other experts. So it's a great honor. Thank you. So we know, like other Southeast Asian countries, smokeless tobacco consumption is very high in Bangladesh as well, and it's relatively high among women. So 25% of women 15 plus years consume smokeless tobacco. So 1 in every 4 women are consuming smokeless tobacco. And as you asked, that the fiscal policies, so tax, we all know that it's an effective tool for controlling tobacco. But in Bangladesh, the tobacco tax was imposed long back, and smokeless tobacco was also, was taxed from 2003. And the ban roll that was started in 2000. So it's not new. For quite a long time, we know that tax have been imposed on tobacco products, including smokeless tobacco. But there are diverse types of smokeless tobacco that are available in the market, but the tax is imposed only on 2 types of products, Zorda and Gul. So the rest are outside of the tax net, like Shada Pata, we call white leaf, and other types of smokeless tobacco. And if we look into the budget speech of the last year, 2024-25, at least on paper, they said that 55% supplementary duty on 10 gram Zorda, and the price is 48 Bangladeshi taka. That means 4 cents of 10 gram Zorda. And for Gul, it's 25 Bangladeshi taka for 10 gram. That is 2 pence, nearly 2 cents of 10 gram Gul. So this is so cheap. So even if you impose 55% supplementary duty, so the price still remains very low, and it is affordable. And what the figures I said, it's on paper, but in reality, you will see that 5 gram, 2 gram, and even loose Zorda and Gul are available in the market. So that's really affordable. So people can buy it easily. Everywhere it's available, though there are, there are law in place that you can't sell to young people, or you cannot sell near the schools or educational institutes. So these are only on paper. So the implementation is really weak, like other Southeast Asian countries as well. So it is affordable and you can get it very easily. Now, if we look into that, the tax collection. So as Ashish also mentioned, that smokeless tobacco remained a less priority and non-priority, I would say, for the National Board of Revenue. And only 2021 smokeless tobacco manufacturers, they pay the taxes. If I give you some figures from 2022-23 fiscal year, so in that year, the overall tobacco tax revenue collection in Bangladesh was 2,600 million US dollar approximately. And out of these, the smokeless tobacco tax revenue collection was only 3.6 million US dollar. So that means 0.14% tobacco tax revenue is collected from smokeless tobacco. So definitely the National Board of Revenue doesn't give it a priority. And given their less capacity, limited resources, they feel that, okay, let's focus on cigarette and bidi and collect more revenue. So that's how, as the National Board of Revenue, that is government, is paying less attention to smokeless tobacco, sometimes we feel that the attention from other, the advocates sometimes focus more on cigarettes and bidi. So that's really not we expect. So a number of reasons that we always discuss, and we know one of is that the informal setting. So we know that smokeless tobacco is produced in informal settings. That's why it is very difficult to impose to collect tax from them. But we are saying this for so long. So if the NBA takes the initiative to find out that who are producing and give more efforts on that, I'm sure that they can collect more. But as I mentioned earlier, that it remains less priority for them. The ban roll and the other, pictorial health warnings, all these are also less, important, or we saw that the policies are not implemented properly. In a recent study also, we found that like 84% smokeless tobacco products in the country, they don't follow, or there is no pictorial health warning, or even if there was health warning, which is very small, so it is not complying with the national policy. And the 30% of the packet of smokeless tobacco had no text health warning. So those are also not maintained in the country. So from that, I think it's really important that government prioritize smokeless tobacco, the tax and also other measures, and the advocates also prioritize. And there is less data, limited information on smokeless tobacco as well. I think we need more evidence to use those for increasing the tax and also other enforcement of laws. So more research and more evidence generation is really important for smokeless tobacco. I would just take a few seconds maybe that the ban roll and the tax that I mentioned that was imposed in Bangladesh from 2000. So these also needs improvement, because the smokeless tobacco products, these are so small. So even if that you can't stick those ban rolls or tax stamp on those, so tax avoidance is very easy for them. And as I said, they are in informal settings, so they are in any way not under the tax net. But those who are under tax net, they can use those ban rolls or reuse. So it's possible for them to avoid some taxes. So for smokeless tobacco and also for overall tobacco control, it's really important that government emphasize on more tracking and tracing of these taxation and digitalize the entire system, so that starting from the production, distribution, and the entire supply chain, government can track that how much is produced, how much is sold, and who is paying tax, and how the entire process is operating in the country. So the modernization and digitalization of the entire tax administration system is really important, as we always say that it's the high time in Bangladesh and also in Southeast Asian countries that we develop the capacity of National Board of Revenue. You might have seen recently that the National Board of Revenue was suddenly dissolved in the country, and there was an initiative that there'll be two separate institutes, that one will prepare the policy and other will do the tax collection. I think this is a very good initiative, in a sense that we feel the demarcation is really important, that those who are preparing the policy and those who are collecting the tax. So this should be two distinct body, but they will work, of course, in coordination. If one unit does both, then it creates lots of pressure on them, and sometimes there are conflict of interest as well. However, the way it has been done in Bangladesh created some tension among different groups, especially the NBR officials. So we hope that government will take proper measures and move ahead, so that the National Board of Revenue can function properly, and their capacity is developed, so that they can emphasize more on overall all types of tobacco products, but especially on smokeless tobacco, so that we can gain our public health goals, and the tax collection is also increased, and the public health improves in the country. I'll stop there, and if there is time, maybe I will come back. Thank you so much.
Yes, thank you, Professor Romana. I think that's a very I think you have elaborated, I think, all aspects of tobacco taxation, and especially related to smokeless tobacco. One of the problem is that the products are so sold in such small quantities that actual impact of tax increases are not felt. And that's one, I think, in the question, Dr. Rakesh Gupta is also making that point, that these small sachets, I think those are the big trouble for us in terms of taxation itself and even tax administration. So I think this is where standardization of tobacco products, and especially standardization of smokeless tobacco products with at least a minimum quantity, base price, and a fixed excise, I think those are some of the areas which I think the countries should or could consider to handle these challenges. So I think we'll come to Dr. Manuja and talk about the youths then. How all of this is perceived by the youth themselves, and how do you see that? What is the youth feels about the tactics of the industry, and how do youth respond to them? How do do they feel that is it the cultural normalization of tobacco and SLT, or new normalization or a new norm being created by the industry, and how do the youths are perceiving them, and what role does this misinformation or the tactics are playing in the current scenario? Let's say from, if you have examples from Sri Lanka or even in the region or otherwise, will be great to hear from you.
Okay. First of all, thank you for inviting me, and I'm really honored and grateful to be here. So when we talk about youth, we do have this alarming, it alarmed us because our most recent global school-based health survey, which was conducted in 2024, actually showed the smokeless tobacco rate as 7.3%, which was an increase from 2.6% in 2016. So actually, it's more than like tripled the rate of smokeless tobacco use among school children aged between 13 to 17. So if you think about the younger age group, the 13 to 15 year age group, the percentage of use was 11.1% among males. So every 1 in 10 male kids who are between 13 to 15, who are like, early teens, they reported that they are current users of smokeless tobacco. The rate was 16.1% among male students who are older, 16 to 17 years. So actually it alarmed us because the actual trend for smokeless tobacco was that our traditional form, the betel quid with tobacco, was actually going out of fashion and was denormalized. So what they are now having is not actually the traditional betel quid. They do have it because it's accessible to them. Most of their homes have it yet because the adult generations are having that. But they are also buying sachets, as you have said. Like we actually don't know what's in them also. It's more than tobacco. And some sachets that were analyzed give traces of other spices, areca nut, and some only have tobacco. But the thing is, we are actually quite blind in this area because we actually don't know what are the products, the full range of products available in Sri Lanka as well. We don't actually have a system to do that, and we don't have a monitoring system. Even though we have banned smokeless tobacco use, we have actually banned it. The thing was, the right after the ban, you may have heard this story before, in 2016, right after the ban, there was a press conference, and the media was the journalist, or, pretending to be journalists, was like quite toxic in their questioning and was talking about why are you banning the traditional, it's our tradition, it's our culture sort of thing. And the officials was like, no, we are not banning our traditional betel quid. So the message given to the whole of public and the authorized officers is that even though we have banned smokeless tobacco, we have not banned the traditional form. It's not technically true. It's not technically true. And for certain time being, they were asked not to sell them like betel quid together. So they are supposed to sell betel leaves separately, areca nuts separately, tobacco separately. But now it's in market. So it's readily available, accessible, and quite affordable compared to other tobacco types. And even though we have banned it for 8 years, people still use it. However, it's not glamorized. It's not the posh thing to do. It's not the posh thing to do, and it's not the normal thing to do for urban youth as well. They are not, deliberately buying it to keep their nicotine addiction going. What we observe is actually they buy those sachets, which are, for the first time it's given free to them by a school friend, a big brother from neighborhood sort of person. and they start using it and they continue to use it without knowing that it's tobacco. So it's something they use. It's something in their, what their peers use. It's they don't, I mean, they are not, I mean, you know, deliberately using tobacco. So that's the scenario here. I mean, like, you know, so we are a bit alarmed that, I mean, I know it's a lower rate compared to other countries in the region. And we actually don't think it's an underestimate because, you know, I mean, 1 in 10 early teens using is quite a big number for us because we do have lower tobacco use rates. So our main concern is them still using it, even though they don't want to use it. So we have to address the issue of these sachets, these smokeless tobacco products being available in our market amidst them being banned. So that is about the perceptions. Do you want to know about strategies that we have used or anything? Or is it for the next round?
Yes, come back on
Okay.
the second round. Yeah, thank you so much. And I think this tobacco industry tactics and their idea. I think same thing happened in India also when they, you know, when there was this gutka ban, then they separated the tobacco and pan masala and created the twin pouches so that they could sell them both. And you know, the matter went to the Supreme Court, and all of that happens. And that's the industry how it actually innovates and continues to innovate, you know, and use technology so that it can, you know, it foresees. So basically, this is the difference maybe in tobacco control work and tobacco industry work, that they look at their market 20 years ahead, that what would be their profits in the times to come, whereas we are not able to see how to get rid of tobacco in the next 10 years or 20 years. I think that kind of a difference that's what we are facing. So I'll thank you so much for your comments, and I think this is alarming to see rising, you know, prevalence of tobacco use among children across the region, and especially smokeless tobacco, as Ashish was also pointing, because there's less taboo, you know, easily accessible, and so that, you know, it becomes the initiation part of the tobacco use, and maybe then they go on to using other products or substance abuse. So I think I'll come back to Dr. Swasti. I think for the next round, I'll request for just maybe less than 2 minutes, or I'll say 1.5 minute, 2 minute quick remarks, so that we have at least 10 minutes left for question answer, and also the question that we are asking to the audience. So Dr. Swasti, I would want to request in terms of what can we do to restrict the online marketing and surrogate advertising of SLT industries, and you know, what could be the regulatory and other mechanism that you feel, whether at the national level or regional level, you know, how do we get rid of online marketing and surrogate advertising?
Thank you, Amit. I think that's a very challenging task that we have, and we also know that our Cigarette and Other Tobacco Products Act 2003 predates even the FCTC. So we need to strengthen that, and we are trying to plug that hole, which you have just quoted, by amending the Cigarette and Other Tobacco Products. That's one of them. Then online reporting portal, which I also said in the beginning, is one area which we are trying to improve on the implementation of the enforcement, and the interministerial collaboration and within India and also beyond, so that all agencies work together for the common cause. And we also need to target the IEC through IEC the youths in the language they speak. So we do what is known as tobacco-free youth campaigns, etc., utilizing influencers and people from the industry, people from the sports industry, particularly, talking to them so that they deter themselves from initiating tobacco use, particularly smokeless tobacco, and also efforts against TAPs, particularly the endorsement and sponsorship. And we also have several sections which we are trying to implement it, but what I must say is we must emphasize working exclusively in the youth, in the schools, in the villages, in from tobacco-free villages as well, and focus on tobacco-free youth campaigns. The ministry, for example, has done 2 rounds, and we are making it a yearly event. And we have also sent out many advisories. So it's a difficult task, but if you continuously do it on a regular basis with youth in focus, I think we can achieve something. This is my take as of now.
Thank you, sir. I think engaging with you directly, I think that's an important aspect of unmasking the appeal also, and the youth campaigns in last 2 years have, I think, made that some of that dent with the tobacco industry. So thank you for your inputs. Dr. Kaur, I would request you to share some of these ideas, if there are any, and as Dr. Swasti was talking about interministerial and interdepartmental coordination, what are the areas of cross-country or inter-country collaborations in terms of protecting the youth? Because the digital space it doesn't have boundaries, and everything is accessible across boundaries. So how do we collaborate with each other to mitigate that? Any thoughts from your side on that?
Thank you so much, Amit. And I think very rightly said by Swasti, a lot of coordination is needed in that. And especially in this world of, digital media, digital marketing, everything, it's there for everybody. And like I said, that internet sales, to which, youth can access and they can just get the products at home. So a lot of inter-country, inter-regional collaboration, like I said earlier, is required. And we have, some guidance from now the cross-border this thing from the Article 13 guidelines. But then more efforts from the countries acting among the countries, collaboration with the evidence they have, and the sharing of best practices, sharing the resources also. Like India has for tobacco testing, the laboratories and other things. So product regulation, product testing, where that capacity is not there. So those kinds of things, I think we can share, and then we can produce that evidence, which can, help us with the policy reforms and policy implementation. So these are the few words I would like to, highlight here. Invest in collaboration, invest in coordination. Thank you so much.
Thank you, ma'am. I think and I think that is something unequivocally everyone will agree and know that it is important in the digitized world that we work together. So I'll ask Ashish, so if because you are also working with the multiple region, multiple countries, how do what are the challenges that you see at the communities and grassroots level, and how to mitigate them, in terms of what are the key challenge you feel that's there, and how do we mitigate them, both, let's say, in the digital space and otherwise.
So I'll say just this is we need to stop treating smokeless tobacco as a invisible cousin. That's the word I've been using. We need to accept that the smokeless tobacco has more normal acceptance in the society, and then from there we need to start planning both regulatory as well as a communication strategies. There is a huge accessibility and affordability of this product, so we need to definitely figure out how to work around that. Vendor licensing is definitely one tool, one policy which can be used to limit its availability. Industry in its subtle form, they have been bringing new products, new form of smokeless products in the market. We need to be very carefully assess what is the situation and start preemptively building our strategies around that, so that this time at least we do not fall behind to their strategies. There is a quite fragmented implementation and a lack of resources, I would say. there are policies exist, including, let me give a very quick example is we have this ban of mixing tobacco in food. However, we know that in almost all the pawn shops, they are mixing smokeless tobacco in food and serving it. Not just in India, but also in Bangladesh and many other parts. So those kind of how we are going to deal with that. In a very nutshell, I would advocate for uniform regulatory standard across all tobacco products. That's one. Policy enforcement is required at a local level. We need to, including the digital platform, but we need to develop innovative youth-driven and a youth-focused communication strategies to denormalize these products. And at some point of a time, we need to clearly start thinking on a sustainable financing for community-based program and civil society engagement. We all know that this the financing in this sector has been shrinking, and civils the last by the I would not say large, but yeah, it's a government-driven program, but it is largely supported by the civil societies, and obviously they need a very small amount, but they need some amount. So I think at some point of time we need to see how this society, the community initiatives can also be supported with the minimal finances. Yeah, please look into closing the policy loopholes, which smokeless industry is exploiting. So that's where my thoughts are.
Thank you, Ashish. So I'll come back to Professor Romana. I think one of the areas is tax administration and and in terms of implementing them. So how do you feel is there evidence-based policy making to address taxation, including illicit trade, which is also part of tax administration? How do we deal with these two within the regional space? Because again, we are all connected in the region, and that becomes a challenge in no taxation if there is a difference between taxes in countries, and I think that happens as illicit trade, which is again industry raised also issue. But how do we deal with this?
Thank you. So I again would advocate that tax administration should be strengthened, and as part of that, we need to think that whether the current tax system, that is ad valorem system, whether that is the ideal one. Rather, shall we move towards the specific taxation? Because we have seen in other countries that when specific tax has been imposed on tobacco products, the tax revenue has been improved. Revenue collection at the same time, public health gains have improved as well. So for this dual purpose, I think we need to focus more on the system change from ad valorem to specific taxation. A few other issues that the standard packaging, so we need to really think through that this 5 grams, 6 grams, 10 grams, instead of that, can we say that standard packaging like either 50 gram or 100 grams is the standard, so that can be done. Licensing, already Ashish mentioned, so we need to do the licensing, and also we advocate for a comprehensive tobacco tax policy for the country, so that will capture all these areas, which also needs to include the market monitoring, that is the part of enforcement, that whether all these are really implemented. So periodic market monitoring by the government is really important. For the illicit trade, I think it's sometimes the smuggling is the issue that tobacco company highlights rather than other forms of illicit tobacco. But smuggling is really small, and recent evidence shows that it's not an issue that we should be scared of while we talk about tax increase. So it's a governance issue to me. So government has to regulate, the smuggling other. So it cannot be an argument for keeping tobacco tax low. So I again advocate for increasing the price and tax base and shifting to, if possible, to specific taxation. and I agree with all other, and we really should work together in Southeast Asia, generate evidence, share with others, share data and lessons learned, and work very closely so that we can reach to our goal. Thank you.
Yeah, thank you, Dr. Romana. Dr. Manuja, I think last but not the least, you were talking about strategy. So I think briefly, what are the key interventions or strategies to handle the situation in terms of the industry tactics, which is targeted towards youth?
Yeah.
Quick inputs.
Yeah. So I think if I really want to summarize it, it's like involve and engage them and involve them. Like it's not only about improving their knowledge. It's about involving them in controlling processes. What I've really seen working is them understanding that this is not a choice, but it's manipulation by an industry. So exposing the industry tactics to them is what I've seen that worked well than, just giving knowledge about the products and asking them not to use it because it's a harm. Because we do have lots of experience in engaging them. For example, we had a nutrition promotion program where they identified using tobacco in household level as a determinant of undernutrition. So youth realize that if you don't address tobacco, you may not be able to solve the problem of undernutrition and household poverty as a whole. So, them improving their insights about the actual harm, that tobacco being a determinant of many other public health problems, and also being aware about the industry tactics. They get more engaged and more involved, and by their day-to-day life settings interventions, it doesn't have to be big projects. Their day-to-day interventions to their friends, their peers, that works well. I have seen it working well. So that's my 2 cents about it, I guess.
Thank you. Yeah, thank you so much. And thank you all the panelists for your interventions. I see some questions. I think I'll start with the last one so that we can handle some of them. I think this is specifically on Indian tobacco control law. So I'll request Dr. Swasti. So there is a law in the country and which is a comprehensive law. And what can we do to help implementing this law in a better way? And how can we tackle industry interference in that it does in violating the law or maybe not implementing the law? I think that's the question Mr. Anuj Dave has asked. How do we further strengthen our implementation and protect?
I lost you in between. Can you just repeat the whole question again? I lost you in between.
Yeah. The question is, we have a comprehensive COTPA. How do we help effective enforcement of COTPA, and how do we protect COTPA from the industry influence? Because the industry is not 100% complying with COTPA. That's the question.
That's a very important and nice question. I'm to do it, and we have a very good law, but unless you implement it, it remains a paper law only. So the first thing is understanding the law, and then while understanding the law, sometimes we should also know that for many health issues, particularly tobacco, the solution doesn't lie within the health ministry only. So we need to work with different ministries. So many of you are also working at the state government. So what we have done is to implement it, we have a mechanism what is known as a state level coordination committee at the state level and a district level coordination committee at the district level. So all the provisions of the law and even beyond that, the objectives of the National Tobacco Control Program, where we have interfaced with many agencies, particularly the Ministry of Home for the police, for the enforcement and education for the tobacco-free education institutes, and also many other. We all sit down together at the district level, implement it and monitor it together. How, in brief, we do that and protecting it from the vested interest of the tobacco industry. We have the Article 5.3 of the WHO FCTC. But in India, for the Ministry of Health, we do have a code of conduct which kind of regulates or bans interaction with the tobacco industry, with whom we do not have any common interest, and we have a let down procedure for that. But more than that, what I keep telling is, we should be clear of why we are doing tobacco control. We should know the why very well. If you know the why, because of the premature mortalities, the morbidities, the woes, and the kind of calamities which every family, who has had a victim of tobacco related disease, dying in the family, leaving the family behind, knowing all that, and knowing health as well as the socio-economic situation tobacco renders to our society. If we know this why well, then it is much more than a simple code of conduct which is in paper. So that's how we should protect the tobacco industry attacking the law of the country.
Thank you, sir. Thank you for that lucid explanation, and I think highlighting the significance of implementing the tobacco control laws also. I see a question from Mr. Vasant, Dr. M. Vasantha. How extensively are tobacco cessation interventions implemented at the primary healthcare level in India? I don't know if Dr. Swasti would want to answer, or I should ask Dr. Rana. I see him here. I can ask him also to answer.
Dr. Rana can answer. He knows it.
Dr. Rana, would you like to respond to this question? Are you there? Okay, I think Dr. Swasti, you'll have to do that.
Okay, thank you. So what we have done is tobacco cessation centers. We have a quit line. So the number of which is available in all the tobacco packets. So anybody can call the quit line. We have about 2.5 lakhs calls every month, which we are servicing around 30%. The remaining 70% we are trying to integrate outbound calling, then M cessation, etc., and address them. Apart from that, if someone wants to visit a physical tobacco cessation center, we have in every district hospital and many sub-district hospitals, and also 302 dental colleges as a mandate of the National Dental Commission has to have a tobacco cessation center. So we have added to the pool of TCCs 302. Then, and last year, the Honorable Minister, during the campaign of Tobacco Free Youth Campaign, has also announced that we have tobacco cessation center. We should have tobacco cessation center in all the medical colleges in this country. And under the National Oral Health Program, we are training every dentist in this country who are working in the dental units, be it the primary health center, community health center, or the district hospital dental units for tobacco cessation. IDA, Indian Dental Association, has also a program for training the dentists working in this country for cessation. In future, we'll be training the NCD counselors also for tobacco cessation. That way, India has prepared a strategy with all of you in participating in that, how we would be scaling up tobacco cessation in this country. So in a way, we have done our bid for offering cessation to the masses.
Yeah, thank you, sir. I would request, can you share some insight on what is happening in Sri Lanka and Bangladesh on cessation at primary level, or if not, then Manuja and Ramana, Professor Ramana can also intervene. I think three of you, very briefly, maybe 20 seconds each.
So in Bangladesh, if I can say, it's again at a very initial level. We are working to establish, integrate quit line with the Ministry of Health, existing quit line or a separate one, establishing a separate one. We are also working with them to integrate tobacco cessation services in their TB control program and NCD control program, which is at a community clinic level at that what they have. But yeah, it's a very, very early stage, and compared to the need, what we have, it's still at a very, very limited level, I would say. I would request Dr. Manusha to share about Sri Lanka.
Yeah, okay. So Sri Lanka does have a quit line with NATA, 1948. The use of it is, the use to get quit smokeless tobacco is, I think, minimum. And we do have a very accessible primary healthcare service system where MBBS qualified doctors are there within 3 kilometer reach for any citizen in Sri Lanka. However, even though people go there to seek help to quit alcohol addiction and other substance addiction, going to a medical doctor to ask for help to quit smokeless tobacco is very rare. So people don't think that they need help to quit, and so I don't think we are doing very well in cessation services in Sri Lanka.
Yeah, thank you, Dr. Manuja. I think this was the first question, but I would maybe hear last 30 seconds from Dr. Romana. So this is one question that in India we feel that if you don't ask these questions, our sessions are not complete and we don't feel that we have delivered the session well. It says, why can't we force the tobacco producers and industry to suck at one go? Why do we need such running around bushes to regulate the tobacco content and packages? So if you would like to respond to that very briefly.
And the practicality is that definitely the National Board of Revenue has dependence on tax, and at the same time, there are many other interest group also. So if we want to stop in one go, we'll get lots of protest from within the ministry as well, or within the government. So that of course this is what we want, aspiration, but what we can do is that we can set a goal that when we want to stop tobacco consumption in the country and move ahead with some plans so that all these different interest groups can be maneuvered or well taken care of. And also we have lots of support in favor of the advocates and against the tobacco industry. So we cannot deny the power of the tobacco industry, not only from Bangladesh, but for all over the world. So definitely we have to work on that, and we have to make sure that government also understand and finds other sources of revenue, tax revenue, and government prioritize public health goal rather than tax revenue. Thank you.
Thank you. I think very well put, ma'am. Thank you so much. Thank you all the panelists, and I'll now hand it over to Dr. Prashant back for the question or poll from the audience, and then closing the session.
Yeah.
Thank you very much.
Yeah, sure. So thank you so much, Dr. Amit, for coordinating this entire session, and I am quite hopeful that all the audience has actually gained a much needed insight of different aspects of the tobacco control which is happening in this part of the world. So now we are up for the polling. So all the participants will actually see 7 questions, and you have the options too. So I would actually request to quickly finish this, and the questions are here. You have probably 5 minutes to actually complete these questions, and these are not very extensive ones, and the options are also given.
I think Dr. Prasad, you should give 2 minutes.
Okay, 2 minutes now.
They are very easy and quick responses. Everyone is able to access the poll. If they have any challenges, please let the institute know. And we have just 1 response as of now, 2 responses.
So about 40% participants have actually attempted these questions. I would actually request the remaining to actually do it faster. So while our polling are continued, and we still awaiting approximately 40% of more people to actually complete this entire survey. In the meantime, to actually fasten our this entire webinar, I would actually thank each and every one of you, particularly to the experts who have actually joined over here with their very busy schedule, and enrich this entire discussion. It's a long road ahead, and there are many aspects which need to be dealt at the same period of time. And as the discussion actually shows that various dimensions have actually covered, and all the dimensions are equally important to curb this epidemic. At last, I would actually request the director, Shani ma'am, if she has anything to say before we actually close this webinar. Ma'am?
Yes, thank you, Dr. Prashant. I think this is a very interesting panel discussion that we had, and we could hear from Sri Lanka, Bangladesh, SEER region, and also our country, how much efforts we are making, and also Dr. Ashish Pandey, who has covered the other AMRO region. So how much efforts we are making towards controlling and making our policies, making the youth and our communities aware of the harms of tobacco, the cessation opportunities available. We are trying to make policies, but as we all understand that the tobacco industry is always ahead of us. And now the nicotine products are also being prioritized by the industry over tobacco products. And we do not have enough data from our countries because it's banned, but the data from other countries where it's freely available is so clear. And I would urge each one of the participants, to list down their experiences, even if there's case studies about people who are using these new emerging nicotine products, that they've had adverse effects. So, publishing data from the research community and academia is so important otherwise the industry will have its own publications with all those conflicts of interest. And our small researchers will be drowned in that. So we really need to encourage, even if it's a small publication. That's my really appeal to all of you. And of course, each one has to do their bit to make the school children especially aware, because it's the youth that this whole year, I think we should not stop till we have made the youth aware and the children aware that how harmful nicotine is. And we've also said that apart from cancer, the nicotine products, they are harming the other bodily parts. So most people are not aware about the other systems, which the nicotine harms. So this kind of information should also be shared, because right now people just think it's cancer. So apart from cancer, we have to focus on the other cardiovascular diseases and other diseases, not just oral cancer. So it is very interesting to hear all the perspectives from all the different countries and how packaging and all these kind of prioritizing control rather than revenue collection. We all have the same story to share. But I was really interested in which country. I couldn't hear Dr. Ashish Pandey said that the railways has mentioned that they're not going to transport. So it may be possible you can mention. And thank you very much to all our esteemed speakers and panelists and all our participants for taking part in this webinar and panel discussion. Thank you.
So, thank you, ma'am. And now we are about to, about to end this webinar. We have also reached approximately 80% of the polling. So, as a population scientist, I am actually satisfied with the data which we are now having in our hand. So, thank you again to each one of you for your contributions. And I will be actually sharing the draft of this entire webinar to each one of you. Thank you so much and goodbye.
Thank you, everyone. Thank you for your time.
Thank you, everyone.